Awesome. So my name is Elise Rudolph. I'm the Director of Online Recruitment and Admissions with the Online Masters in Public Health program. I use she, her pronouns. And Stephanie, would you like to introduce yourself?
Yes, thank you so much. And I'm Stephanie Nguyen. My pronouns are she, her. I'm the online education recruitment manager, and I support students with providing, or we as a team collectively support students with learning about the program, helping you with your application, and just figuring out your strengths to put in, and getting you to submit something that feels authentic and strong. So we're excited to have you here, and we're going to pass it along to a very special person that we are so excited to have join us today.
Yes, we are really delighted to have a current student on the call with us, Taiwana. So thank you so much, Dr. Taiwana Gross, for joining us this evening. Dr. Taiwana Gross is a dentist, entrepreneur, and public health advocate committed to advancing health equity. After earning her BS in mathematics from Hampton University and Doctor of Dental Medicine from Temple University as a National Health Service Corps Scholar, she began her career servicing underserved communities across South Carolina. She later founded Precision Dental, where she integrates family and cosmetic dentistry with a focus on access to care for Medicaid recipients and uninsured patients. Dr. Gross has developed pipeline programs for minority students, mentors future dental professionals, and collaborates with coalitions to address oral health disparities. And of course, as I mentioned, she is a current student in our program, pursuing our epidemiology and biostatistics concentration. And she has the goal of bridging clinical practice, research, and public health leadership. So thank you so much for joining us, Dr. Gross.
Thank you. Thank you so much for having me. I'm really excited to be here and welcome to everyone that decided to come and join us in this information session. I remember being at one of these information sessions myself. It was very insightful. And I'm just here to be able to help and give some insight on what it's like to be a current student.
We're so grateful to have you. And yes, Tawana will be able to weigh in and offer some insights throughout the presentation. And then, as I mentioned, we'll have Q&A at the end. So if you have questions for Tawana, or of course for Stephanie or myself, we'll be able to answer those then as well. Alrighty, so points that we'll cover in this presentation. We did our introductions. We're going to talk about what makes our program unique. We'll go over outcomes for our students. And then we'll talk about some of the logistics about our program, what to expect in terms of course load, things like that. We'll talk about the various student services that we offer our current students, and cost of attendance, funding, important questions like that. And at the end, we'll go over the admissions process. All right, so what makes us unique? We consider our points of distinction that we are a diverse, rigorous, and stimulating academic program. So being an online program, we attract usually mid-career or later career professionals from a variety of different sectors, and we'll talk about that in a moment, but we have folks coming from all sorts of professional backgrounds and all across the country and even the world. So we have folks, I think, in our program from 32 different states and I want to say 5 different countries. So it really is such a unique learning community. And Taiwan could certainly share more about this, but I feel that our students bring so much to the classroom and learning environment. And it just is such a unique dynamic to be studying alongside peers and other professionals who have so much career experience behind them. Close-knit community. So something that I think is really special about our program is that, and this really ties in with supportive learning environment as well. But our close-knit community is that we have 2 summer visits as part of our program. So each summer we invite all of our online students to come on campus. You get to meet in person. We'll talk more about this, but we essentially put on a conference for everyone, and it creates these really amazing bonds between our students, the students and the faculty. The staff get to meet the students in person and vice versa. So it creates this really welcoming community. And we know that a lot of our students end up staying friends with their cohort members for life and see them go on to have other personal and career wins as well. And then supportive learning environment. So something that's also special about the Berkeley Online MPH program is that we really are like a homegrown operation. We were Berkeley's first online program, and we do everything in-house. We have our own team of instructional designers who help create the online modules and make sure everything is accessible, up to date, that we're providing you cutting edge online learning. All of our staff are UC Berkeley staff. All of our faculty who teach in the program are UC Berkeley faculty. So this really is the true experience of what we're offering on campus. We're offering it online as well. And not all online programs have that same experience. So we're really proud that we're able to offer that high quality UC Berkeley education in an online modality. And in terms of outcomes for our students, we know this is obviously a huge part of why folks consider a master's degree. So this number here, the 111,000, is an average salary reported in 2023. So we don't have our most up-to-date data, but I would suspect this number has gone up a little bit over the last couple years. And we have folks across a variety of different career sectors. So we have current students and alumni who have worked in academia, who are working in the public sector, maybe for community-based nonprofits, things like that. We have folks in healthcare, dentists like Tawana. We have nurses, doctors, folks like that, clinicians. We have folks going the data analytics side, or researchers, folks working in pharma, folks working in biotech, things like that. And we have even had folks pursue legal careers, or maybe they've had a legal career and they've added the public health component onto it. So there really is a variety of options for public health graduates. There are so many different sectors you can apply this work to, you can apply this degree to, and we're able to support our students in whatever direction they're interested in going. And with that, I'll pass things over to Stephanie to talk a little bit more about what public health is.
Public health promotes and protects the health of populations through evidence-based research, education, policy, and community-based prevention. And with this in mind, we have 4 concentrations that we offer, and we have a concentration curriculum that's designed with flexibility to support your goals. So in the next slide, I will talk a little bit more about that. And the 4 concentrations that we offer are the interdisciplinary concentration, health policy and management, food, nutrition, and population health, and last but not least, epidemiology and biostatistics. So if you're looking for something that has a broad range, something like the interdisciplinary concentration can be a really great fit. But if you're looking for something that can still have flexibility, but have very niche fixed courses to help you get closer to your desired goals, then any of the other concentrations are there as well to support you. But what's unique about the interdisciplinary concentration is that we offer tracks within that specialty or the concentration, and that is community health sciences, global health, spatial data sciences. So you can use those as a combination of courses and kind of create something of your own through those tracks, or you can use those as electives. And within health policy and management, what's really nice about that is there are 3 specific courses that health policy and management students are required to complete as a part of their their curriculum, and that would naturally give you a health management certificate on top of your MPH. So it's kind of like a 2-in-1. But you can explore our course catalog a little bit further once I send out these slides here, or just head over to our website. But while we have Tawana on the call, I would love if you could walk us through your process of choosing health policy and management initially when you applied to the program, and how you ended up changing it or changing your concentration to FB. So before you answer this, the one thing I can share with you on the call is you can change your concentration. So the first year is a fixed schedule. We require students to complete their core and breadth classes. And as you get closer to completing that, if you find that you're more in alignment with another concentration that we offer, it's a very simple process for us to make that change. So Taiwan, I would love to hear more about your process on an experience on that.
Okay, so as Elise mentioned earlier, I am a general dentist in Greenville, South Carolina, and I have a private practice. It's Precision Dental. And what actually drew me to the program initially was that I felt that I wanted to help people not just on the individual basis that I was doing every day in the clinic. I wanted to be able to help on a more broader scale, and be able to give more impact to the population, the region, the state. So I had started joining some of the different dental communities and dental organizations in the state of South Carolina. And I quickly realized that a lot of the organizations were very intertwined with policy. So initially, when I started the program, I came through the health policy and management. And my first class, the first class I took, it was two, but one was epidemiology and then environmental health science. And after I took that epi class, I was like, you know what? A light bulb went off and I said, this is it. This is for me. I love math. As Elise mentioned, I was a math major. That was my undergrad. And I just love science. So it was, I had no idea. I knew nothing about epidemiology at the time. But going through the class, I realized, you know, I did, take a lot of health policy courses. So I still have those tools that I'm going to need to be able to do the advocacy that I would like to do for my community and for the state. But epidemiology is going to allow me to do my own research and actually take from the patient level and scale things up to do some community partnerships with some of the medical schools and the dental schools and different things like that. But I decided, I think I changed it after that semester. So it was only one semester and then I changed, but it was very easy to do. I actually met with my program manager, and they, walked me through how to do everything. And it was good for me.
Thank you so much for that. And I love that you emphasize the your experience of exploring different options as you go. And that's something that our program will really support you through, is that you're not completely locked in. You have the opportunity to learn as you go, because there's so many things that will come to you when you are a student. You don't have everything mapped out early on. Sometimes the exposure comes as it happens in the program. So I really love that you pointed that out. Moving on to the next slide, I wanted to talk a little bit more about the program overview. So our program is a part-time, 90% online program. We are 10% in person, and we have 7 semesters that we go through within the program. There's 2 campus visits that require your attendance. The type of degree that we would issue is a professional MPH. So this requires you to gain niche skills, to be a strong public health professional. This degree does not indicate that this program was completed online. It's a popular question I seem to get, but do note that it's one type of degree that all students would receive, or MPH students would receive. It's just a Master of Public Health graduate degree. The course delivery, so the lecture materials are provided asynchronously, so that means not live, with weekly deadlines. Office hours are held in real time, so if you are planning to meet with a graduate student instructor or a faculty member, they do offer live office hours as well. The course model is first year students are going to complete 6 pre-assigned core and breadth classes. So it's a fixed schedule. We will tell you when to enroll, what courses to enroll in. So it's a little bit more structured in that first year in comparison to your second year, where you will complete more focused more classes that are specific to your concentration and elective courses. For student services support, as Tawana mentioned, there is a program manager to support you with some of the logistics in the program, but you'll have a faculty advisor and a program manager that are going to be there to help you along the way. And there's a larger group of student services team, which I'll get into down the presentation, but for the most part, you'll work most closely with your program manager and your faculty advisor. The average time commitment can vary depending on your class and a few other things, but generally it is a part-time program, and you'll average about 15 to 17 hours weekly on your weekly deliverables. So all things that include academic reading, your homework, and so forth. The average units enrolled per semester are 6 units, which totals out to typically 2 classes a semester. The units required to graduate are 42 minimum. And the capstone, it's a comprehensive exam that's also an open book. And what I like about the comprehensive exam is you are measured on all the things that you've learned throughout the program. And we do have some study guides and sessions to prepare you before you take the comprehensive exam. So you're not just thrown in there. You will have a lot of information preparing you as you get to that point. But wanting to shift the conversation back to you, Tawana, I'd love to know what drew you to this program's online/hybrid structure?
Well, I actually compared quite a few of the online programs. I needed online. I'm a solo dental practitioner. I have to be at work and I don't have a lot of free time. I'm a mom um, and a busy mom at that, a daughter that loves gymnastics. So I needed something that was going to be really flexible. One thing I did notice that was different with this program and some, the lecture materials are all asynchronous. There were online programs when I went to the information sessions, they would say that they were online, but you may have this class where you need to be there at a certain time. And I really needed the flexibility. So this program, I can say as a student, definitely offers that. Most of your classes have options where you will be live, which is also a plus that it doesn't, you don't have to feel like you're alone. You certainly want to go and participate in those live sessions they have. They're just not mandatory. So it gives you many options to connect with students, many options to connect with your teachers and facilitators. It's just a good program for somebody who, like myself, you work and you may have a family or you may travel a lot. The professors are very understanding because they know that you are working. And so the program was, for me, it was one of the top choices based on that flexibility that it would give me.
Thank you. And considering that you are a very busy person, how do you balance school, work, and personal life?
Yes, that, it right now, for example, it's the fall. I love football. And I don't just like to watch it on TV. I like to go in person. So I'm taking 2 classes now. What I do for me, like, they said the average 15 to 17 hours weekly. I try to do a little bit every day. Um, at my lunch break, I might be going through a lecture or some reading. And at night, I do a little bit before I go to bed. So I kind of pace myself. I've learned that works best for me. I've had instances where if I know I'm going to a football game or I'm going out of town, well, I'll take maybe the weekend before, and really just do a lot of work that day. But I will say, I was nervous initially, thinking, like, would it be too much? Um, I still am traveling. I'm still, working the 30, I do 36 hours a week, and it hasn't been a problem. I will say you do need to manage your time well. Most classes, they give you really, they give you early entry usually in your course, so it gives you a opportunity to look through the syllabus, kind of familiarize yourself with how the course is going to go, and then there's usually a kickoff session, and they'll answer any questions that you might have about the course and the layout. And I think going to those, and also those are recorded if you can't be there live, but just looking at those, you start to get a rhythm for yourself. But I am one that feels that, you do need to work hard, and you do need to study, but I also feel like you need to balance your personal life too, because it is, a rigorous curriculum, no matter what concentration that you decide. But it's very doable. And like I said, let me think, this weekend, yes, I'm going to a football game. So, yes.
Well, I'm glad you're making time to do a little something fun for yourself. That's so important. I love that. So moving on to our summer visits, I mentioned this earlier, but essentially, one of the unique things about our program is that we do have a required in-person component. So we describe our program as being 90% online. And then over the course of the 2 years, 7 semesters, once in your first summer and once in your second summer, we bring all of our students together on campus for about a week-long visit. It's, roughly 5 to 7 days. And it's sort of like this big conference that we put on for our students. We have some in-person lectures. So sometimes you'll have some of the lectures that would be online. You'll have those in person from our faculty. We usually bring in guest lecturers. We build in some professional development elements. You have an opportunity to meet with staff or faculty. We usually do some lunches and some social networking events as well. So we try to make it engaging and enriching. And our students often tell us this is their highlight because they're meeting everyone in person that they've been connecting with online for several months, or sometimes even a full year, depending when you start the program. And I wanted to ask Taiwana, do you have any favorite summer visit memories?
Yes, I have many, but I'll give one. As Elise and Stephanie were saying, with this, you get the opportunity to actually get to see the professors and a lot of your cohort members in person. And I remember my first group project was with 400 individuals, and we would do like a lot of texting. We worked together, but I mean, even to this day, we just text each other. We're not even, because we're doing different concentrations. We just text each other yesterday, because I'm like, what are you taking, for the next the spring semester? But I'll say that these are great opportunities to really get to know the school, and your classmates. My most fondest memory was my second year visit, which was this past summer. I got to meet a lot of the international students, and I had never actually had any group projects with them, because a lot of times you'll be grouped by your time zone. So I never had met them, but it was at one of the social events, and I was actually leaving and they were coming, and we just sat down and we were just, talking about, with class and just life. And so that was back in May, and we are still, I talk to them all the time now. It was two gentlemen from Uganda, And we've actually, it's about 4 of us in our cohort. We put together this almost like this think tank. And just last week, we had applied for a grant to kind of jumpstart this nonprofit, and we got the grant. So, I just was I look at it like I wouldn't have thought about this like a couple years ago. Like, oh yeah, you're going to be interacting with people that live all the way across the world, and like one, he's a medical doctor. Another does things with in the public sector there in Africa. But it's just amazing. So I will say, like, these summer visits are, there is a work component to it, but it's really an opportunity, like I said, to, what I liked going to the school is to be immersed in it and get a feel of UC Berkeley, because one, it's a beautiful campus. I'd never been there until my first summer visit. It was a very beautiful campus. And like I said, just getting to know your classmates on a more deeper level outside of some of the assignments that you'll be undertaking through the program.
Thank you so much for sharing that, and congratulations.
Thank
This
you.
is so exciting. Moving on to the fall program timeline. So as many of you exploring, you may be curious to see how our program cycle runs. And it's, again, 7 semesters. So in the first 2 semesters, students will take 15-week courses to build a strong academic foundation. We really want you to get situated because we know many of you have not taken an online or completed an online program before. So this gives you an opportunity to digest the material, learn what buttons mean what, and really get situated with being a grad student. And starting in the 3rd semester, the schedule will shift over to 6 to 8 weeks of instruction. So as you can see here, the courses in blue just indicate that you would be taking those courses together at the same time. And then all of the other terms are usually concurrently taught. So it's kind of like summer term, how you have the first half and you complete it and you move on to the second course. And then that concludes summer sessions. So same process from that. So if you're going the traditional route, it would be 27 months, 7 semesters. If you are interested in completing the program in 2 years, so 24 months and 6 semesters, that could be a possibility. And the way that you would do that is in the second year, you would increase your workload to 9 units. So this means that you're now taking 3 classes, which typically totals to 9 units or so. And you would do that twice out of the 7 semesters. The other option for some students that may be at a point where they need to take a break for whatever reason, you can also delay your graduation time. And you have up until technically 5 years, and you can pace the program for a little bit longer if that is something that just applies to your situation. So these are things that you can always consult with the program manager. I would say most students tend to stick with the traditional 27 months, but there are other pathways that could fit within your schedule if necessary as well. Moving on to the RISE office. So as I mentioned earlier, there are a larger team of student services that are going to be here to support you throughout your journey. And I really wanted to highlight the RISE office because they are going to be very, very important and contribute to your success in the program. So the RISE office is the Berkeley Public Health Careers and Leadership Office. So they support students and alumni in a very large way by helping you clarify your goals, build professional skills, and establish connections through your practicum, through career planning, and leadership development. So those are the 3 main buckets that you'll have the opportunity to work with them for. And this can look very unique in the sense that they may have employers come to talk about their role and what types of jobs are out there. Or it could be something as, let's say you graduated and now you're applying for a job and you need help with a mock interview. They are there to support you in different capacities. But one important thing that all students must complete and is the exciting part of the program is the practicum. So the practicum overview is essentially a guided professional experience where students are going to apply classroom skills, gain professional exposure, and build networks within a structured process. So they are, I would say this is mostly self-directed, meaning that you will do a lot of the legwork in finding your practicum, but you are still offered guidance from a practicum consultant on the RISE team to help you and ensure that you are meeting the necessary requirements for the practicum. So you'll have a preceptor and a RISE practicum consultant, so someone on our end and then someone offsite. And together you will work on a practicum that is fitting for your interests. This is a really exciting concept and time for you to apply all the things that you've been working hard towards learning, and utilizing this time to explore different public health goals that you've had but never really had the capacity or time to commit to. So it's a really good opportunity to expand on that. A preceptor. So a preceptor is the on-site professional at the organization that you'll complete your practicum, and they will supervise the overall practicum. A practicum consultant, as I mentioned, is a RISE staff member who will support you throughout finding the process, ensuring that they can sign off, and making sure that you've met your necessary goals. Finding practicum opportunities. So we have a system called Flex. This is where it's an online platform, kind of like a job or career platform. And a lot of times preceptors will self-post an opportunity for you to apply. So a practicum job search can be very similar to finding like a regular job, for example. If you see the job posting and it appeals to you, you'll apply as such. The time commitment, duration, and location. So you must complete a minimum of 130 hours. The average duration of this practicum is usually 3 to 4 months, although there are some students that have spent a little bit longer, some students that completed it a little bit sooner. So the average is around 3 to 4 months. Location is pretty flexible. So depending on what you find and secure, it can be hybrid, it can be in person or remote. And on the right-hand side here, you'll see the different sectors and organizations that students have completed their practicum at. So whether you're interested in working closely with research work or maybe more focused on nonprofit and more applied skills front-facing, there's going to be different types of opportunities that you can explore. And if you don't know where to start, that's not an issue at all, because the summer visits that we just spoke about, we actually have an overview where we'll cover some details and groundwork around that. But then you're also welcome to book an appointment with the RISE team to go over the practicum as well. And that is encouraged just to ensure that you are set up for success. Moving on, I'm going to pass this over to Elise to talk about the cost of attendance.
Great. So obviously, the fees and financial side of grad school are important, and we want to be transparent about any costs associated with our program. So currently, our program fee is $1,629 per unit. Our program is 42 units in total. So 42 units, again, across those 7 semesters or 27 months typically. There are a few campus fees, so that $800 charge for fall and spring, and the $450 charge in the summers. And a lot of students ask us why there's a campus fee if this is an online program. And so that goes toward any sort of campus resource that our students, even our online students, are able to use. So being an online MPH student, you are first and foremost a UC Berkeley student. So you have access to a lot of campus services as an online student too. So you can have remote access to library services, to counseling services. Some of this may go toward tutoring or things like that. Even like our financial aid office or places like that, campus units that our online students can work with as well. There is something called SHIP, the Student Health Insurance Plan. If you are a domestic student, you're based here in the US, and you have an employer that offers you health insurance, or you have health insurance through another means, you do have the option to waive SHIP. So most of our students do end up waiving SHIP because they're working full time and they might have health insurance through their employer. So you do have that option. There's a document management fee, our instructional resilience and enhancement fee. It goes towards making sure that our online coursework is continually updated. And that brings the total cost of our program to around $75,000 if you waive SHIP, which again, the majority of our students do end up waiving SHIP. And there's a variety of ways that students fund their degrees. So the first option would be self-funded. So if you are working full-time and you're able to cover the costs of the semester out of pocket, then certainly that's an option. And because this program allows you to work full-time, some of our students are able to pay out of pocket. If you are paying out of pocket or partially out of pocket, you can apply for a fee payment plan, and this would allow you to pay in 5 monthly installments. There's also federal student aid. So we highly encourage everyone to complete FAFSA, even if you aren't sure if you're interested in using federal student aid, but it's great to fill that out and see what you would be eligible for. I will see that federal student aid at the graduate level is typically unsubsidized student loans. So it's a little bit different than undergrad, where sometimes there's sort of more scholarship style aid available. Now, if you are eligible for federal aid, sometimes you are eligible to convert a portion of those loans into work study. So that would allow you to take on a campus job and do some like a campus position, usually for a limited number of hours a week, and convert some of those loans into like a career position, essentially, or a part-time job, rather. And there's also public service loan forgiveness options. So these are changing periodically, so definitely check out that PSLF link that we have here. But if you are someone who works for a government or nonprofit agency, you may be eligible for public service loan forgiveness. So that's definitely an avenue to explore, and we have had students take advantage of that in the past. We also encourage everyone to explore if their employer offers any tuition benefits. So some employers include like a stipend toward higher education as part of their overall benefits package. So if you aren't sure, definitely reach out to your HR department and see if that's something that might be offered at your workplace. And then we encourage everyone to look for outside scholarships. ASPPH is a great resource where they have sort of compiled a long list of different scholarships that would apply for public health. I always tell folks to check local, see if your community offers any higher education oriented scholarships. And then we offer the Dean's Health Equity and Leadership Award each term. We award 3 students. We call it the Dell Award. So we award 3 students, and it's around $11,000 in total. All right. So I'm going to run through this a little bit quickly for the sake of time, but if there are additional questions at the end, or if you'd like more information, you can always email us. Essentially, for admissions, we have a few prerequisites. We want to see statistics or college level math passed with a B+ or higher. This is to show quantitative preparation for some of those heavy quantitative courses you'd take in the first semester. We do require a minimum 3.0 GPA, which leads to the next bullet point. We want to see your advanced GPA calculation. So this is your GPA from your last 2 years of undergraduate, and we're looking for a 3.0 or better. If you don't have a 3.0, don't rule yourself out. I would encourage you to reach out to Stephanie and myself and talk through how to make yourself competitive in the application process and still show quantitative and academic preparation. We require 2 essays, the statement of purpose and the personal history statement, 3 letters of recommendation. Those do need to be from academic or professional references. If you've been out of school for a while, 3 professional references are completely okay. We do need transcripts from every institution you've attended, community college, your study abroad semester, everywhere you've gone to school. Please give us every transcript. We'd like to see a resume or CV showing your work experience, and there's an application fee of $135 for US or permanent residents and $155 for international applicants. If you completed your undergraduate degree in a country where English is not the primary language, you may need to submit a TOEFL score or an IELTS score showing English language proficiency. And some very good news, we do not require the GRE, so don't worry about that. You don't need to take it for our institution if you haven't already. And Taiwan, I wanted to check with you, when you were going through the application process, were there any resources that you took advantage of, such as meeting with Stephanie or coming to an information session?
Yes, I did do the information session, and I don't even know if Stephanie remembers this, but I called her because I had questions about this list particularly. I don't know why, but I was getting almost like this imposter syndrome, and I'm like, oh, is this the program for me? I've been out of school for quite a long time, and she got back to me directly. And I was very surprised, like, because usually, like, you don't always get the person that, that you see also at the information session. So I was like, okay, this is great. But she was able to answer most of my questions. Again, like I did attend this session, the information session, which both were helpful for me.
That's great. I'm so happy to hear that it was, yeah, you had a little bit of extra support throughout the application
Yes.
process. Thanks so much, Shawana. And that's definitely what Stephanie and I are here for. We want to make the application process as transparent as possible and to help you put your best foot forward. So we are accepting applications right now for our fall 2026 cohort. Applications are due, we have a priority deadline for fall. Applications for our priority review are due January 5th. If that feels a little too soon, you still have until March 2nd to apply for fall. And that would be to start the program in August of 2026. And then if you're still kind of in the early stages of exploring, we also accept applicants for our spring term. So we take new students every fall and spring. And if you're applying for spring, you have all the way until August of 2026 to apply to start the program in January of 27. And lastly here, we have our contact information. So don't hesitate to reach out to us if you have any additional questions. Stephanie does one-on-one advising, and so you can sign up for that here. And we encourage you to check us out on social media. Just that we also have an upcoming application workshop, which is our writing workshop. So that's going to focus specifically on, writing your 2 essays for admission. So definitely join us for that.
Yes, and now that we've concluded our presentation, I will stop the recording here, but wanted to just say thank you so much for riding along the journey with us today, and hopefully you found this helpful.